Hello everyone, this is Dr. Pragya Dadhich, Assistant Professor of Mahatma Gandhi Physiotherapy College. So we will discuss about CABG.
Coronary artery bypass grafting. So, what is CABG? Coronary artery bypass surgery, also known as coronary artery bypass graft, is a surgical procedure to treat coronary artery disease, the buildup of plaques in the arteries of the heart. It can relieve chest pain caused by coronary artery disease, slow the progression of coronary artery disease, and increase life expectancy. It aims to bypass narrowings in heart arteries by using arteries or veins harvested from other parts of the body, thus restoring adequate blood supply to the previously ischemic heart. The goals of CABG are restore blood flow to the heart, relieve chest pain and ischemia, improves the patient's quality of life, enable the patient to resume a normal life, lower the risk of a heart attack. Now the indications: patient will with blockages in coronary arteries, patients with angina immediately after myocardial infarction, life threatening arrhythmias caused by a previous myocardial infarction, occlusion of grafts from previous CABG, then the contraindications of CABG: congenital disease, valvular disease, diseases of blood, hemorrhagic diseases, pregnancy, uncontrolled arrhythmias, severe hypertension. Then the investigations of CABG: ECG, chest radiography, isotope scanning, coronary angiography, echocardiography, MRI. Then the procedures of CABG: artery grafts, which is mostly internal mammary artery, is used. Vein grafts, which is saphenous vein, is mostly used for grafting. The first one is traditional coronary artery bypass grafting or on pump surgery. It uses a heart lung machine. This machine temporarily takes over the heart's job of pumping oxygen rich blood to the organs and tissues. This is traditional type of open heart surgery. Chest bone is opened to assist the heart. It allows surgeon to operate on a heart that is not beating and has no blood traveling to it. Beating heart or off pump coronary artery bypass grafting, it doesn't use a heart. This type of surgery is limited to a few specific procedures. It is also known as beating heart surgery. The next one is heart lung machine. It is a device used in open heart surgery to support the body during surgical procedure while heart is stopped. The heart lung machine is often referred to as the pump and does the work of heart and lungs during the operation. The next one is minimally invasive technique. In this type of surgery, surgeon will make small incisions in the side of chest between the ribs. These cuts can be small as 2-3 inches. Surgeon will insert the surgical tool along with small video camera to see inside the body. The next one is robot assisted technique. In this type of procedure allows for even smaller keyhole sized incisions. A small video is inserted in one incision to show the heart, while surgeon uses remote controlled surgical instruments to do the surgery. The heart lung bypass machine sometimes is used during this procedure. The complications are wound infection and bleeding at the incision site, stroke, pain, pneumonia, breathing problems, kidney failure, abnormal heart rhythms, blood clots that can cause stroke, heart attack, lung problems, or even death, memory loss, fever associated with chest pain, irritability and decreased appetite, and preoperative myocardial infarction. The post-operative CABG: after surgery, patient will typically 1 or 2 days in an ICU, check patient's heart rate, blood pressure and oxygen level regular during this time. An intravenous line will likely be inserted into a vein in arm. Through the IV line, patient may get medicines to control blood flow and blood pressure. Urinary catheter, chest tube, oxygen therapy, temporarily pacemaker to control abnormal rhythms. Next, the one is PT management. In PT management, phase 1 of cardiac rehabilitation, it involves immediate inpatient exercise rehabilitation that emphasizes patient education and counseling. Exercise therapy, musculoskeletal range of motion activities, daily life activities like standing, sitting, and walking. Purpose, counter the deconditioning effect of prolonged bed rest, prepare patient for a return to normal daily activities. Exercise prescriptions for phase 1, range of motion exercises, enhances blood flow to damaged areas, accelerate tissues repair, increasing muscular strength and flexibility. The second one is ambulation. Low in intensity initially include self-care activities progressed to slow walking, range of motion exercises and daily life activities, later stair climbing and formalized physical activity program after gaining proper physical strength. Third one is discharge plan. Continuation of rehabilitation program after discharge. Pre-discharge plan includes dietary counseling, education on medication, exercise prescriptions for use at home. The fourth one is exercise intensity. Should not exceed 2-3 mats. Use of Borg rating of perceived exertion scale in encouraged after first few days in the hospital. FIT principles for phase 1. Frequency 2-3 times per day, intensity right heart rate plus 20, duration 10 to 20 times, activity range of motion walking one flight of stairs. Phase 2 cardiac rehabilitation. Once a patient is stable, outpatient cardiac rehabilitation may begin. Initially, patients have an assessment with a focus on identifying limitations in physical function, restrictions of participation secondary to comorbidities and limitation to activities. Phase 3, this phase involves more independence and self-monitoring. Phase 3 centers on increasing flexibility, strengthening and aerobic conditioning. Goals. The goals are facilitate long-term maintenance of lifestyle changes and secondary prevention. Includes educational sessions, review in clinics, ongoing involvement of family. FIT principles in phase 1 and phase 3. The frequency is phase 1 is 1 to 2 times per day, and intensity right heart rate plus 20 repetitions of 13s. Durations is range of motion, treadmill like walking, jogging, biking, arm ergometer, weight training. And in phase 3, 3 to 5, the frequency is 3 to 5 times per week. Intensity is 60 to 80% per heart rate maximum. 60 to 80% heart rate maximum. Duration is range of motion, biking, jogging, swimming, weight training, endurance sports. We will focus on health education, home visit, and individual or group education sessions. Thank you.